hopefully you should be able to see a very bright coloured flag in the start of the Women's Tour of Great Britain in Henley the year before last. Does that sound about right?
Yep.
Yeah, it stays.
Yeah.
Excellent. So thanks very much for inviting me along. I really, really appreciate it. My name's Josh Lenthall and I work for a charity called Active Oxfordshire. Some of you may well be familiar with Active Oxfordshire, others perhaps less so, but in a nutshell, we exist to fight physical inactivity and tackle health inequalities within Oxfordshire. And we do that with many, many partners across the county. All I'm going to do this evening is briefly take you through some of the examples of community interventions that we've been kind of involved in one way or another. And then later on, my colleague Matt is going to sort of give you the bigger picture of how that all fits together into that picture. The one thing I sort of really want to emphasize, I suppose, at the start is that everything I'm going to cover is us just being one part of a much bigger partnership or collaboration. We don't, as Active Oxfordshire, own or control any of these projects on our own, and we certainly wouldn't try to do so either. So actually, I think I've tried where possible to reference all the various partners and people and organisations who have been involved with us. If anybody has been omitted, it's a genuine accident. It was a nice problem to have, trying to find all the logos and try and make sure they're on the slides. If I have missed anyone, it's an accident rather than a deliberate omission. So just very quickly, the context we're kind of operating in at the moment is that we have a physical inactivity crisis in the country and in Oxfordshire as well. At the moment, we've got 68,000 school-age children who are not meeting the Chief Medical Officer guidelines, nearly 100,000 adults, and we know that this most severely affects people from the less affluent households. And children from those less affluent households don't get the same outcomes in terms of swimming and also in terms of cycling. So that's kind of where we started from on all our work about a year or so ago. Obviously, we weren't predicting COVID-19 and we weren't predicting the Keyworkers project that I'll come on to shortly, but we know that in terms of cycling, that children from and families and people in the less affluent parts of the county face significantly more barriers. And what we're hopefully going to go through this evening, myself and Matt, is where we've identified those barriers, what we've been trying to, who we've been working with, and how we've tried to sort of navigate around some of those barriers. One of the barriers that does come up a lot, and it's probably often one of the ones people think of first, is the cost and the finance around cycling. And the two figures I've got there in terms of £3.21 and £12.11 are the spends of different households on sport, physical activity and leisure. So the £3.21 is what a family of four from a lower socioeconomic group, to use the kind of parlance, would have each week, compared to £12.11 in other households. So what I'm trying to emphasise there, I suppose, is that finance and costs are definitely a barrier to people, and actually perhaps more so than we realise. And to put that into context, we've spoken to some families and some people across the county who are really keen to get into cycling, and it's certainly a cheaper option than pretty much any other form of transport. But to put that into context, an inner tube is £4 upwards, depending which inner tube you get. £3.21 doesn't necessarily go very far, and we need to kind of address that, and kind of whilst acknowledging that it is still a much more cost-effective means of travel. And the other bit of context, of course, we can't get around is COVID-19. The impact that's had on physical inactivity, on people's health, on people's well-being, and the way people move about in their day-to-day lives. And what it's emphasised really, I think, is a need for urgency. And the Keyworkers project, which I'm going to come on to now, is a real showcase, I think, of how people collaborated quickly and effectively and urgently to meet a need that we certainly weren't predicting. So moving on to the Bikes for Keyworkers programs, that's one of the sort of dominant projects that we've been working on over the last 7 or so months. And the timelines, and these are some of the partners on the left here that we've been working with. And like I said, I'm sure I've missed somebody, but it's certainly not deliberate. I thought it would just be worth capturing where it all started and who was involved initially, and then where we've got to now, I suppose. So in terms of the timelines, I remember sitting one Saturday morning, idling away on Twitter, actually, strangely enough, and a conversation popped up that Windrush Bike Project were giving bikes to Keyworkers over in Witney in West Oxfordshire. And somebody, I think if I'm not mistaken, it was Richard Mackenzie, who you may know as Richard, the cycling gardener, sort of said, well, why can't this happen in Oxford? And sort of there was a sort of consensus of, yeah, why not? This was a Saturday morning. By about 4 o'clock on the Monday, I think, we had the first gathering of interested parties, which included Cyclops, ourselves, I believe Damien Hayward was on the call, Broken Spoke were there, there was, and others as well. And so within sort of, 48 hours, there was the first meeting of the Keyworkers project, as it were. 2 weeks later, we were up and running. And it was kind of that quick from kind of an initial thought and taking the lead of what Windrush Bike Project were doing in Witney to the Oxford branch of the bike project being up and running. In terms of who's involved, yes, there's many organisations involved, but there's also many people involved. And I'll come on to some of the figures in a moment, but it would be remiss of me not to mention specifically Catherine and James McNichol, who have been an absolute tower of strength throughout this entire process. I think when we did sit there on that Monday initially, I don't think we thought we'd be still going now, potentially 7 months later, and the impact that it would have. So it'd be wrong of me not to mention them specifically, but also many of the people who volunteer their time very, very generously, being preparing bicycles, moving them about the county and the city, and many other sort of roles in between. So thank you very much to everyone who's been involved. In terms of the aims, initially, I think when we first sat there, we said, well, we think we might be able to raise £10,000, we think. And we then sort of did some very rough calculations of how much we thought that might cost us to get donations, to refurbish them, to get them ready, to move them to where they're going. And we kind of made a bit of a guesstimate that we could do about 130 bikes, I think was kind of what we were thinking initially. So off we went, and we opened up a referral pathway with OUH and Oxford Health, opened up a fundraising page, and it kind of started, and that's kind of how it initially started. And the reason, I suppose, behind it was that we knew that Keyworkers, many who were frankly sort of on the front line during the initial lockdown period, would struggle to get to work because public transport became unviable for the most part. Not everybody drives, not everybody has a car share arrangement. Not, there was a very logistical problem of people being able to get to work. So that was one of the kind of issues we were trying to tackle. I suppose the roads were quieter at that point, sort of blissfully quiet, if I remember rightly, and we felt it was a good opportunity that if people are going to return to cycling or consider active travel, that actually it was as good a time as any. So that was a kind of another bit of our logic at the time. And we thought we could build a bit of a groundswell of kind of people who are beginning to actively travel and cycle to work for the first time. And importantly, actually, to support and show we felt it was us doing our bit, I suppose, as a community. It's what we could offer to the Keyworkers who were doing an incredible job on the front line. Where we are now, so instead of 130 bikes in Oxford, we're at 280 and still counting. If you add in the bikes that Windrush Bike Project did, and also Cherwell District Council, who have a kind of a satellite model of the project, it's 380 bikes, and again, probably counting as well. There's over 20 volunteer mechanics who have been involved throughout the process. We've raised collectively through public donations, grant applications, and in some cases, people very generously selling their own bikes to raise money to donate to the project, over £19,000, including gift aid. And what we've done is expanded the package as it's gone along. So initially, we were giving locks and lights and the bike to the Keyworkers. But then actually it became apparent that actually it's all very well having a bike, locks and lights, but if you're not a confident rider, actually a level of tuition might be appreciated. It might just be a refresher in some instances, or some people were returning to cycling after many years away. And then subsequent to that, maintenance became sort of an issue. Just because you've got a bike you can ride, it doesn't necessarily mean you know how to sort of keep it on the road and do the basics. So we were able to work with Windrush Bike Project and offer some virtual maintenance options to people as well. So over on the right here, I've just got some of the icons of some of the sort of the barriers we're trying to break down, I suppose, and find solutions to, really. So the lock being the safety and security of the bike, we hear quite often that people want to ride, but they hear about bike theft being a big thing and protecting themselves against that. And sometimes that can put people off taking the leap into cycling, tuition and owning a bike, maintenance. And also we've been really pleased to work with Wheels for All through this process, who have been helping with the tuition, but also with some of the wayfinding. Because there's some people who are confident riders, but they didn't necessarily want to take the route that they perhaps would drive. They wanted to find the more quieter, perhaps safer, you know, that sort of route instead. So Jennifer and Wheels for All were able to offer that and take people out and sort of do a couple of dummy runs to work and, you know, to find the best way as well. So the package expanded as it went on, and it's grown, and now I think as a county we will end up, I think we've been given a generous donation by Oxford Health to produce a further 70 bikes, which would take the county total to 450, I think, when all is said and done, which I hope you'll agree is a phenomenal amount. And certainly when we sat there in early or mid-March, it would have been, I think, we certainly weren't expecting that. And to be honest, that is largely due to Cyclops' involvement and throwing their weight behind it in such a proactive and proactive way. And all the projects I'll come on to shortly are actually are a offshoot of this. If it wasn't for the Bikes for Key Workers project, the other projects I'll refer to wouldn't actually be happening. So those are some kind of figures I've just thrown about there, but actually there's a wider impact as well. In fact, I'll just put something in my way. Here we go. So 62% of the key workers are using the bike for commuting. Some are using it for commuting and recreation, and some are just using it for recreation. We've seen a 29% increase in physical activity levels across the whole cohort of key workers. Now, my day job is working in physical activity. If we saw a shift of a couple of percent, we'd be pretty delighted. It's quite a hard battle to fight. 29% is big, and we're now looking at some people are coming to having had the bike for 6 months, and they'll have that sort of follow up, and we'll see how that number fares. But certainly an initial increase that we were really pleased with. One of the really nice ways we were able to work together was with the likes of Broken Spoke, Cycloanalyst, Warlands, Walton Street Cycles, and other independent bike shops and co-ops across the city. We were able, in what was probably quite a difficult, precarious time in some respects, able to, not life-changing by any stretch of the imagination, but provide some funding or at least work with those shops to make sure that we were supporting our independent businesses and cycling economy locally. One of the nice things I've heard about quite a lot now is the connection between the mechanics and the volunteers, and that's kind of grown organically. I understand there's a bit of a kind of virtual swap shop. If somebody needs a pedal or something and somebody else has got one, then there's a bit of a deal that can be struck, and the components and what have you get moved around the city. And you know, and that's been kind of just one of the nice offshoots of the project. Collaboration across organisations. I don't think the organisation I work for, Active Oxfordshire, hadn't done certainly any formal work with Cyclops before, and with some of the other organisations we've been involved in. So that collaboration will only hopefully grow in strength. And actually there was a real extensive coverage of it. There was an initial piece where Alison spoke to BBC South with Andy working on a bike in the background. There's been numerous Oxford Mail articles, radio coverage, and it really has kind of captured people's imagination. Now what I'm going to show you next is just and actually one of the testimonials from the key workers. Now I acknowledge the slide is quite wordy, but I was trying to edit it down. Actually it kind of tells its own story, so I'll flick it forward. I'll give you a moment just to digest it, because it is a little bit wordy, but this is from one of our early beneficiaries of the project. So I'll make sure I will share the slides in case you haven't had a chance to whiz through all of that right now. But that is one of probably hundreds of testimonials that have come in, and of a very similar ilk, where people have returned to cycling through this project, or it's enabled them to get to work around different transportation issues that have kind of borne out over the last few months. And actually this lady in particular sent a follow-up after 3 months saying she now cycled. This was early on, shortly after receiving her bike, and after 3 months she was cycling to work every day, she was saying, which is fantastic. So we'll keep in touch with the key worker who've received the bikes, and we'll keep updating the data. But this is just, I thought, a nice way of demonstrating that. In a moment, I'll move on to what's next very quickly, and how Bikes for Key Workers has led on to other projects, and how we're sort of tackling some of the barriers that some people face to cycling. But it is worth emphasising, I think, that without Bikes for Key Workers and without Cyclops' involvement in that project, the things I'm about to talk about, in particular in East Oxford, probably wouldn't be happening, or certainly not at the scale we're able to bring it about, because of, in a way, this project has shown us a blueprint. It's shown us how, if everyone pulls together, we can actually do pretty extraordinary things pretty quickly. And we're absolutely delighted to have played a small part in it. So in terms of what's next, we are working on one project in particular. It's called Ready, Set, Go, which is in partnership with the Oxford Hub and Wheels for All Oxford as well. And what that aims to do is a collaborative campaign that aims to ensure that every child in Oxford City is able to learn to swim, and more relevant to this conversation, able to learn to ride a bike, and to support their families to be involved in that as well. We know that children in the more disadvantaged parts of the city, and the county more generally, actually, won't cycle in many cases, for a whole range of reasons, some of which are at the bottom. So there's finance can be an issue, as I mentioned earlier. Yes, cycling is much more cost effective than pretty much any other mode of transport. However, referring back to those figures around £3.21 a week, you can see how that doesn't stretch particularly far potentially. Security, we've spoken to many families who've said, I'm worried about saving up, buying a bike, getting a lock, paying all that money out, and then it getting stolen. So there is a concern that people face there. If somebody hasn't ridden for a long time or ever, there's a serious confidence or cycling skills issue. Maintenance is an issue that people come up against. And again, wayfinding is one of the issues people come up against. And that is a sort of a smattering, I suppose, of some of the barriers people face. Some of them are much more in depth than that. Some of them, there's maybe a bit more nuance to it in some cases. But the project in East Oxford really will focus particularly on families. And there's been some really nice journeys we've kind of seen over the last month or two, where a child has taken part in a summer school, which has been run by the Oxford Hub, where they receive cycle training. After that cycle training, they received a bike, a helmet, locks and lights, and a follow-up session of tuition with Wheels for All. And then subsequent to that, there's been quite a few cases now where the parents gone along on a Sunday, and the child's had their lesson, and the parents sort of got tempted themselves. And so on Friday, Matt and myself were at Orchard Meadow Primary in Blackbird Leys, where around 20 bikes were being given out to families, who, many of whom had actually, their child had started on the summer camp, they'd had a follow-up lesson, mum or dad or whoever looks after the child at home has seen that and got themselves interested. They've now got a bike, they're having tuition, and you can see how it kind of hopefully starts to snowball a little bit. And through this project, what we're trying to do is to get more people on bikes, but in a way that is more sustainable. So where there's participants who are now involved, we're sort of trying to see if could they become potentially ride leaders in the long term, you know, for people within their own community. So there's not things being parachuted into their community at random. And the Blackbird Leys Bike Library came, one of the barriers that we saw that people faced that sometimes prevented people from cycling was children grow really quickly. So we could give a bike to an 8-year-old, but actually 6 months later, that bike might be too small and not safe to ride and that sort of thing. And what we thought was, rather than just continuously replacing that bike and the other bike just kind of goes wherever it goes, actually, could we create a library model where when one child grows out of a bike, that bike is then passed on to a younger child in the community and so on, and the bikes start to move around that way. So they're always in circulation. And when instead of a parent worrying 6 months later, my child's outgrown the bike, I'm going to have to go and buy a new one, actually, the bike library model will allow them to do a bit of a swap, and we can do that. Now at the moment, that's kind of a virtual library, as in they would make contact with Oxford Hub and the bike would magically appear at their front door. In the long term, maybe it'll be a physical library where people go along and actually do the swap and so on. We'd love to do that. We're not there quite yet, and it's quite early days. But this is just an example of one of the other projects where we're trying to tackle some of these barriers. And just again, it's better coming from one of the people who's participating in that project. So I'll just pop up on the screen again, just a little quote, and give you a moment just to read that from one of the local families. Jennifer, who's referred to there, is Jennifer from Wheels for All, who's been doing some of the cycle training for both the Keyworkers actually and some of the recipients of the bikes in East Oxford. So there's lots of stories like this, and it's kind of sort of developing momentum, and certainly as kind of the model is almost a sort of a carbon copy of what was happening with Bikes for Keyworkers. It's just the audience has changed now, I suppose, but the principle of breaking down some of those financial barriers, some of the confidence barriers that people face, that's kind of where we're at. And then finally, the other one that might be of interest is not necessarily specific to cycling, it's more active travel, is the WOW program, which stands for Walk Once a Week. And it's an active travel program that is a product of Living Streets, which many of you might be familiar with as a charity for everyday walking. And we've been working with Oxfordshire County Council Public Health team for a couple of years now. And the way it works basically is that children are encouraged to travel by more sustainable means of getting to school. If they do that once a week for a month, they get a badge that's made out of recycled materials, and then that kind of process happens every month. And then you can see on the travel tracker for the county how many active journeys there are and so on. Now, Walk Once a Week is a target. Actually, 87% of pupils at the schools who participate travel actively every day. So we're way more than once a week, and it's a fantastic initiative, especially given how cost effective it is for schools. The 75,000 was obviously, we were cut in half last year. The school year kind of stopped in March effectively, so we don't have most of March, April, May, June or July that would normally contribute to that data. But where schools are participating in this, it's fully funded for them, for certain schools in certain areas, and where it's not fully funded, it's very cost effective and affordable for schools. And the 4 in 10 car journeys, participating schools see on average 4 out of 10 car journeys swapped for a more active or sustainable option. So that's kind of what we're referring to there. And in terms of the barriers, and little icons at the bottom, it's free. It doesn't cost anybody to do this. It doesn't cost, in many cases, the school will get that project funded. And in other cases, it is extremely affordable for the school. There's no cost passed on to the family. And the wayfinding, my little sign there, is referring to some of the projects we're trying to bolt onto that now, where some schools have issues with congestion. So if you take Sandhills Primary School, for example, they have real issues with congestion immediately outside their school. However, across the road, they have Thornhill Park and Ride with an underpass. And we're looking at how wayfinding and how that can be made to look and feel like a much more appealing option. So people don't drive down the road, they might park and they might stride and so on. So I know that's been a bit of a whistle stop. Thank you so much for your time and for inviting us along to speak this evening. It's just an example of a couple of the projects we're working on, a couple of the barriers we're trying to find a way around. We're open to work with anybody and everybody who wants to work with us on this. My contact details there, and also a plug for a free event that we're running next month, which I'll make sure is in the slides as well, where we're running webinars on further about removing barriers to cycling. And also Matt might talk a little bit more later about active design and the impact that has on people's physical activity levels. My dog has just woken up, so that's probably a good time for me to stop talking, and I'll pass it back to Andy and I'll stop sharing. Thank you very much.
Thank you. It was truly inspirational, Josh. A lovely report of what was and still is a very exciting project. One thing occurs to me, I mean, we've talked about Oxfordshire, but is this experience repeated in other counties? Do you have opposite numbers in other parts of the country that you hear from?
So the Bikes for Keyworkers scheme actually is taking place in other counties. I don't know this officially, but I can't think anyone's going to beat 450, and I'm hoping Catherine and Alison will nod along on the screen. But I'm wanting to get that statistic verified, or that claim verified. But to the best of my knowledge, no one's much over 200, 300 in other counties compared to pushing up towards 400 here. There are other initiatives that around kind of more breaking down barriers and increasing accessibility to cycling. And at the conference, actually, Carolyn Axtell, who does a lot of work with Joyriders in London, is going to be one of the panelists, and actually Alison is on that panel as well, very kindly. So there'll be other opportunities to hear from those sort of people. There are sort of other projects, and we're trying to pinch where there's good practice and kind of make it land in Oxfordshire. But certainly, I think I'd like to think that the Keyworkers project here is kind of leading the way nationally almost.
Well, it sounds like it. Thank you. Were there any other questions people can unmute and ask, or send a chat? I haven't just checked.
Andy, I would just like to ask a question of Josh.
Far away.
Yeah, well, Josh, it was just lovely to hear about the other projects, and it was really how were they funded? It was really the source of the income for those projects, and will it continue?
Yeah, that's a good question. So in the case of the project in East Oxford, Active Oxfordshire has provided kind of the, I guess what we call the delivery funding of around £20,000, which basically is to buy things like the bikes, the refurbishment process, the locks, the lights, and so on. However, we have also been funded by Oxfordshire County Council Children's Services to bring Ellie from the Oxford Hub into a coordination role to actually do the running of that project. We felt it needs its own headspace for somebody to really kind of get stuck into that work, and we're trying to work on referral pathways with Children's Services. So we've kind of put up, I guess, the delivery budget, as it were. The County Council have provided us with some funding to provide the capacity for somebody to come into role and lead on all that work, and to kind of join it up a little bit, because what we're trying to avoid is, I've presented them as kind of, I suppose, projects in isolation, whereas actually what we're trying to do is, and Matt will probably cover this in more depth, is trying to link everything together, because what there are is a lot of assets locally. We're realising that actually if we join it up and make it kind of link into one another, there's a huge potential there. But certainly as a starting point, we've put in a little bit of funding just to get us going, and then we're sort of looking at other options as we go along.
Thanks. One of the things I found most inspiring about the whole project was meeting up with health workers who, for me, epitomised what Cyclops is trying to do, which is just to provide a bit of a catalyst. And so often key workers would come along, and this fairly modest bike would represent a great opportunity. And very kindly, Neha, whose husband and herself received a bike and started cycling across Oxford, thought very highly of the project, and has agreed to have a few words just to tell us what it's been like and her experience of cycling. And also, if you could, Neha, tell us what more you think needs to be done to get more people like you cycling in Oxford. Thanks. Over to you, Neha.
Hi, everyone. Thank you for inviting me for this meeting. My name is Neha Bharti, and I'm basically from India. I came here in Oxford around 2 years ago, and I am a registered nurse, and I'm working with the education team these days. So the experience about my with cycling is, I used to cycle in my childhood a lot, but there has been a long gap. And when I went to Singapore, I was scared of riding bikes again. But then in Singapore, the government have such kind of schemes, like you pay very little amount and then you drive, like they used to charge around 50 cents for an hour, and that makes sense for me. Like I can try, and there were more cycling routes over there. But after Singapore, when I moved to Oxford, I in a new country, you again kind of you're a bit afraid of like doing things because you don't know, like, you know, what kind of rules are there. And I was literally again so scared starting with riding bikes again, like if I don't know whether I will be riding it for long or not. So these kind of questions were there that were actually stopping me riding a bike. I didn't, like, you know, I didn't buy my bike until around 1 year, until like I heard, you know, the Keyworkers project. And then I just thought that it is a good good thing to at least apply, because even if I'm not riding it, I can give it back, so it doesn't cost me anything. And moreover, the when I just thought that nothing is going wrong, you know, just by applying. And whether I will get it or not, it will be again a question. But I would say the team is very fantastic. I literally, you know, within a month I got my bike and started riding bike again, and it really built my confidence. Initially, you know, my husband used to have one bike, and when he like started using his car, then his bike was still there, but I was quite afraid of using it. I never used his bike. But when I got my own bike, so, you know, that made me excited and confident again. So I started using my bike again. And it was quite like earlier, like by walking, my way was around 30 minutes. But with the bike, it's literally, you know, 5 to 10 minutes, I could reach to my workplace. So I would say that it was really quite, you know, nice. Even when I like with the follow-up emails, when Catherine just asked for, you know, like how everything is going on after a month or after 2 months, I generally like talked about my concerns, that like I need a basket. I will probably buy after some time, and then I might struggling with the air pump. But when I never expected that they will, you know, like Andy will deliver all the things very quickly and at my doorstep, because I wasn't able to go to him. It was amazing. He helped me a lot. In fact, he delivered, like he came to visit me twice at my home, and then he fit the basket on my bike, and he gave me another pump. It's really working, everything working so fine. I have moved to Abingdon now, but I'm still, you know, now my children are they are also like using the bike, so they insist me every day to go out because they usually like it. And so we ride a bike together almost every day in the evening. Yeah, so it's really good. Yeah, I would suggest to people, like, you know, it's just the first time that maybe it's a fear, or maybe it's just a hesitation, but once you start riding it, it's fine. Yeah.
Thank you, Neha. That's great. I'm glad your children are riding. Faissatou Adechi also agreed to tell us about her experience. Faissatou, are you there?
Yes, I'm here.
Oh, great. Tell us your cycling experience and what comments you've got about cycling in Oxford and Swindon.
Hi, everyone. Thank you for inviting me along to this meeting. I lived in Oxford for 10 years before I moved to Sweden. And out of those 10 years, I cycled for, I came to Oxford in 2003 as a student. And from 2004 onward, I started cycling. I did learn to cycle, I would say, by accident as a child, because it was a gift that was bought for another kid within the family. I live with a very big family, like cousins and nephew and things like together. So that one bike was shared between probably almost 10 of us. So we teach ourselves how to ride the bicycle, and I never knew it was going to become handy one day, and never really cycle probably for another, I don't know, 15 years until I moved to UK as a student. So cycling, for me, the main reason I started cycling actually was due to the cost of the transport. because I find it really expensive going on a public transport in Oxford. And as a student, pockets were very tight. So it was a very easy option. And it saved me a lot of time waiting around for buses and things like that. So easily I can get to uni on time. And also I don't like to walk. It's not that I don't like to walk, but walking on a long distance, like for prolonged hours, make me itchy. So it's a very funny thing that I have. So it was another way for me to get wherever I want to go. So going to work, going for shopping, anything, everything, wherever I go, I just cycle. And I've never been scared of really cycling. And now that I've learned to drive, I find it even more getting in, behind the car than taking my bike and be on the road. It was just like, I don't know, instant. It has become part of me, cycling all the time. My first bicycle in Oxford was a gift from a classmate who finished and was moving back to China. So she left her bike, and for just few days, I have to teach myself again how to cycle, and didn't take long before I get on the road. Well, the benefits I get from cycling health-wise, because that's the only way I keep fit all of these years. So for that reason, yes, I'm still a cycling now. Cycling from Sweden and Oxford. Yes, I moved to Sweden in 2014, and fortunately, I got a job in Oxford after I moved to Sweden. So at the time, I wasn't driving. So I've got two bicycles. So I'll have one folded bicycle to start with. So I'll fold that one, cycle from my home to the train station, get into the train or get into the bus to Sweden. From there to Unipart, that's about roughly 35-40 minutes cycling to get to work. So I've done that for, I think, almost 2.5 years. I cycle like that every day, and from Unipart back to the train station, get to the bus or the train, get to the train station here, cycle home. And at some point, it was really heavy to carry out this folding bicycle around. So I got a two bike. So one is from here to the train station. I'll leave that one there. And another one, which I usually leave in Oxford at the train station. And then I pick that one to go to work. And so that's how I've been doing it. It keeps me fit physically and mentally as well, because going through the hay, it's as hard as it can be, but it's my best bit, because it's kind of give me a challenge of, it's like, if I can do this, climb up this hill, so I can do anything. So that's the way it makes me feel. And when I'm coming back from work, I love going down the hill. It gives me a sense of freedom. I enjoy it. It's like, it's really nice. I've loved cycling. I've been cycling for a very long time, but the challenge of I've had over the years, well, altogether I've have 6 bicycles stolen. The seat being removed, the wheel being removed, or maybe twisted and things like that. Even though I put like 2 lockers sometimes, it's just like magic. There was a day I left my bicycle at the train station and come back home, and I went there the following day. I said, that's not possible. There was no traces. The locker was not there. Nothing was there. It was just gone. So these are the issue with cycling. So constantly I have to invest in getting another bicycle and things like that. But it has never put me off cycling, because it keeps me fit mentally, physically, and I hate waiting in the cold for buses to turn up and things like that. So it's helped me to get, where I want to go. And yes, it's a very convenient way of moving around. And, I will probably, ask anyone, everyone to, to do the same. It's wonderful, cycling.
Thank you,
So,
wow.
You're welcome.
Well, I think it's most admirable that you worked out how to keep cycling even after you moved. And as you say, people do get very despondent when their bike is stolen. And we heard this a lot from Keyworkers, that they did have a bike and then it got stolen and they really couldn't face the expense and the uncertainty of buying a new one. So the project actually was a bit of a catalyst again to make them think, yes, okay, I'm not having to invest so much and I can try it again. And what impresses me about you and Neha is neither of you have mentioned being frightened on the roads. Neha did say a bit that, starting off was unnerving, but, and we hear that again, that once people are riding, they get confident quite quickly. Anyway, now what would anybody like to ask Faisal or Neha any questions? I haven't looked at the Graham points out that the theft is grim and the police aren't interested. But I think we've covered that. Any other points people want to make? What I'd like...
Andy, one of the points was Simon talking about infrastructure and whether that was a barrier. So I would maybe invite Simon to just ask that.
Yes. Simon, do you want to...
Okay. So I'm Simon. I used to be chair of Cyclops. I have been absolutely bowled over by both these wonderful stories that we've just heard. It's such a good way to and so inspiring. Thank you very much, both of you. I asked the question by infrastructure. I was simply meaning things like the cycle lanes, the quality of the surface, the potholes, the separation between vehicles, motor vehicles and cyclists, and having to deal with signs that say end of bike lane, and then what are you supposed to do? That sort of thing. And it's an aspect that we do our best to try and concentrate on to try and get the Highway Authority to improve, but it's extraordinarily slow work. And I only raised the question because I wondered how far that is actually perceived to be by people who are in your kind of position, who'd not been cycling for a while. Was the thought, oh well, it just feels too risky, or it'll make me too afraid because the facilities are just not good enough that I would have to ride on? Is that something that occurred to either of you?
Neha, do you want to comment?
Yeah, I would like to say it did happen to me because I was quite, afraid of the laws here, because I didn't know about like what kind of, because in India nobody follows any kind of rules. So, so here it's quite scary. Like, if I broken any kind of rule, if I didn't know, so what would happen? So I tried to follow like this, the cycling routes. But when it said that, the end of the cycling route, so I just simply get out of my bike and then just, I walked. I did that twice, but then I was able to, find other routes. And then I also, like when I discussed this thing with my husband, so he also encouraged me, like you can use these lanes, or you can go to, there are a number of other ways that you can find around. So it's fine with me now, but yeah, it did happen with me.
Yes, so so that's the rules of the road, if you like, or
Yes.
what do you feel you need to know just to stay within the regulations? Yeah.
Yes.
Okay.
Faisal, do you want to comment at all about the the sort of roads and paths that you're cycling along?
Sorry, say again?
Well, just wondering if there was anything you'd like to add to how you feel about the roads that you are cycling along.
It actually, you know, when you get on the roads, only then you're able to get that confidence that yes, you can ride. Until, you know, like I said, I was it took me almost a year that I sat at home, you know, just thinking of riding a bike but not doing it actually. So you have to go out, and with these kind of, you know, key workers projects, it's really quite, you know, cost effective, convenient. So you can simply try it, give it a try, and even if you're not, like, if you still not feeling confident, you can give it any time back.
Yeah.
And it costs nothing.
Thank you, Neha, and thank you, Faisa.
May I say, the pothole, I think that's a really, really big issue in Oxford, because the route I used to go to work, Oxford, Cowley Road, there you go. Cowley Road, it's really bad. It's really bad. And sometimes it can really put you off cycling, because, you know, going to the bump, sometimes I have to get a better cushion for my bicycle, because, you know, when you're in a hurry, you can't go fast unless you really have to go slow to avoid this pothole. But if you try to speed up, sometimes you end up having, you know, back pain or pain underneath and things like that. So all I did to survive that, if I can say, is I have to get a better seat for my bicycle.
Very good. Well, thank you to both of you. One organization which has been working to encourage women to get confident on bicycles is ISIS Cyclists. And when I saw that Jane Carlton Smith had signed up to come to the meeting, I asked if she would kindly tell us a few words, because it's not a unique organization, but I think it has been uniquely effective at giving women in and around Oxfordshire confidence to get on their bike. And many of the accounts you hear, they're quite surprised at, you know, how enjoyable it all is. So I wonder if, Jane, you would like to tell us a bit about ISIS Cyclists. Oh, I've lost.
Can you hear me?
Yes.
Okay, because I've just I've got an Android tablet, and sometimes I think maybe it might sort of stop me being heard. I'm not sure. Anyway, now, first of all, I just wanted to say that those two stories are fantastic. And they really illustrated for me how, if you try cycling, you discover, or many people discover, how wonderful it is. But it's that huge barrier of actually trying it, which we really got to overcome somehow. Talking about ISIS, I suspect that most people on this call are very well aware of ISIS. And we did do a Cyclops presentation a year or two ago. So what I'm going to do, I think, is talk about how it's changed since lockdown. Because, I mean, I know it's been said before, but we have discovered from our own experience how our own mental health has been fantastically improved by cycling. Even those of us who don't live alone, you know, I just find myself that I only have to get on my bike every day or whenever it is, and I just immediately feel happy. And at other times, you know, it's quite easy to feel a bit depressed at times, I think, for everybody. So what changed? Well, of course, right at the beginning of lockdown, we could no longer run our ISIS rides, which were previously every weekend in a month. So we did about 4 rides a month and more in the summer. So we started off obviously just having to go out on our own, and then just with our partners if we were lucky enough to have one. But then the rule of 6 came in, and we started arranging small group rides. Now, until very, very recently, our umbrella organisation, Cycling UK, was not happy for us to formally organise rides. And I'm sure that a lot of people on this call are aware of that. So we had to come up with something else. So what we did was set up a WhatsApp group, which you could join by either using our Google group for our hundreds of members, or by looking at our website, you could apply to join that. And we've now got, I think, about 50 people on the WhatsApp group, and it's called Bike Buddies. And the idea was that we would be able to find buddies for rides, groups of up to 6, but without doing the formal stuff that was no longer allowed under government rules. So we didn't have a formal leader, we didn't have a sweeper, we weren't able to help people with any mechanical problems, we weren't able to go to cafes, all the things that we had done before. But what we found was that we were able to do small group rides through the WhatsApp group, very, very spontaneously. If you felt like going for a ride, you just say, anyone want to come with me? And that's worked really, really well. But what it is not doing is helping people who we've been talking about before, who perhaps needed a lot more support to get cycling. I think we had 4 people join us during the period that I'm talking about. One of them joined, but seems to have got rather put off almost instantly by the amount of traffic on the WhatsApp group and left again. But the other 3 are still with us. And they are not necessarily novice cyclists, but I think they're really enjoying group cycling. So on we go, small group rides. We've now re-established the ISIS formal rides this month and started offering short rides and medium rides, because we think that that's the length of ride that's not been well catered for by our WhatsApp group. What it's been really successful in doing is quite long rides for those who are absolutely passionate about cycling. But as Andy said at the beginning, that's not why ISIS was set up. So last Saturday, we held our first 2 formal ISIS rides. Again, not allowed to help with mechanics, not allowed to offer any kind of intimate support, if you want to call it that. But we can, of course, go to cafes if cafes are open, if people are happy to go to them. So that's where we are at the moment. There was a very brief period where we thought we could have rides of up to 15 people, I think it was. I've forgotten now. It changes so much. I think, you know, we have provided a fantastic service for a lot of people, especially people living alone, who really, really needed company, and they've been getting it through cycling. So that's a fantastically good message to give. But I would say that, you know, I do feel that we're not really being able to offer support to people who could do with support. So ISIS has changed. That's not to say it won't change back, but some things that we've done which are new to us will continue. For example, the WhatsApp business, because it's a new way for us of getting people to cycle with without anyone having to organize it, which is fantastic. You know, the 10 or 11 ISIS leaders that we have had a bit of a break. I don't know if anyone wants to answer any questions. I mean, one thing I did want to say, I'd be interested to know if other people have actually observed this, is I feel that the standard of driving on the roads outside Oxford has considerably deteriorated since before lockdown. I don't know why that would be. It could be because of the frustration of people in their everyday lives. But we found an awful lot of over-revving and very fast driving when we're out of town. And of course, that's quite frightening if you're not an experienced cyclist. Okay.
Thank you, Jane. One thing that I think you're right, many people will know about it, but your rides are quite modest in distance when it's called for, as it were, may even only be 8 miles or something.
Yes.
So
yes.
You do
the short rides. Yeah, the short rides are up to 10 miles. The medium rides are usually more like 15, and that's what we've reintroduced as of this month.
Right.
And there's going to be some short rides on Saturday.
Thank you. Well, I just think it's another example of trying to get more people on bikes. So thank you, Jane, for contributing. We're now ready to ask Matt to talk, and again from Active Oxfordshire, but with the interesting task of looking forward, really, and seeing how our infrastructure and maybe even other aspects will change in the near future. The specific thing is the so-called activation plan, but I'll let Matt tell us more about that. Over to you, Matt, if that's okay.
Thanks, Andy. I'll just share my screen if that's okay. I assume that's possible. Yep. Hopefully that's showing my
Perfect
presentation now. I'll just pop it onto slideshow. Okay, so as Andy said, so my name is Matt Roebuck. I'm the Healthy Play Shaping Partner. So I'm employed by Active Oxfordshire, but my role is funded by Sport England in a way that's basically an Oxfordshire-wide capacity. I'm kind of seconded out and then to a mixture of Charlton and the county, and then actually placed into the various city and district councils trying to help them with healthy play shaping, which I'll briefly overview just so to give you the context. But one of the things I've been doing whilst in Oxford on placement, which is where I'm on placement at the moment with Oxford City Council, is trying to help them with their active travels in the city group and trying to develop an activation plan to sit alongside the local cycling and walking infrastructure plan. So I'll give you a very quick 1-minute overview of healthy play shaping, just to give you context of how this comes about, and then go a bit more into the actual what we're looking to do based on those things that Josh has been talking about, but also about the other assets that are existing within Oxford. So healthy play shaping, it's an Oxfordshire-wide approach. Play shaping happens elsewhere in the country. The healthy bit is, I guess, is a bit that Oxfordshire's added on. And the Oxfordshire Director of Public Health, Anzaf, in his annual report described healthy play shaping as being about putting residents' health and well-being at the centre of what we do. So it's about planning, it's about housing, it's about infrastructure, and it's about an economy with all that in mind, that it's actually about people's health and well-being, and that's a better indicator, or a good indicator of economic well-being, is actually people's well-being. So that means applying these principles, and those are the 6 principles there of healthy play shaping, to address stubborn health inequalities and to tackle what they call the wider determinants of health. What that means is we have a great health system. The NHS is great for people that need to use it, but it's an illness system. It treats people when they're ill. It doesn't necessarily keep them healthy or help them keep themselves healthy. And so that's what this is more about. So how do we do that? The principles are that we use something we call a whole systems approach. And essentially that's just recognizing that all different parts play a part in the system, and that, as we'll talk about in the cycling, that addressing one barrier might not overcome the other barriers, and therefore it doesn't actually make a difference. It's also about making sure that it's place-based, so that the way that you might do something in Blackbird Leys might be very different to the way you would do in North Oxford, because of the different assets, because of the different barriers, everything like that. And it's understanding those assets and working with those assets to kind of make what's there and make most of what's there, rather than working with what's strong rather than what's wrong. And that's what asset-based community development is. And so trying to do all that together in a partnership working approach, and say that's to plan for the future needs and to prevent and reduce and delay ill health. So what that is then is essentially we have these 3 pillars of healthy play shaping, which is the built environment. So that's that infrastructure, the highways infrastructure, but also the housing planning, everything like that. We have community activation, which we'll be talking a bit more about now, and new models of care, which can include things like social prescribing and other things, particularly around trying to engage the health system within this approach. So that's a whistle-stop tour of that. And sorry if it's a bit technical, please do ask me questions later, but hopefully it'll just give you a bit of context as to why we've taken this approach in developing the activation plan. So, many of you are probably familiar with the local cycling walking infrastructure plan, and I know Cyclops are very engaged in terms of commenting on it and things like that.
Just
sorry.
There's a very nice word recognition coming on the bottom of people's screen.
Yes.
What it's doing, unfortunately, is blocking.
It's blocking.
Now,
I don't think I can stop it.
No, I can either. That's okay then.
I think it's yeah. Unfortunately, it's set into my into the presentation. So
that's fine, just as long as everybody knows. Thanks.
Okay. No worries. What was I saying? Yeah. So the local the local cycling walking activation plan. Basically, it's evolved as a sister document to the local cycling walking infrastructure plan, the LCWAP, the LCWAP. So I won't have to keep saying all those all out loud. So the LCWAP obviously sets out measures and programs to which it says to achieve transformational change in the levels of cycling and attractiveness of walking, but it's through the highways and supporting infrastructure. But it does actually note that this map is in there. These two maps are in there, which are the proportion of people cycling to work and the areas of deprivation, so people facing social or health inequalities. And they match in terms of that eastern southern arc. There's less people cycling, and that's the areas of need. And if you look at Oxford cycling levels, it is one of the highest in the country. But in those areas, it really isn't. So the activation plan is trying to focus on some of that, and some of the stuff that comes out in the which is priority 7 of the infrastructure plan kind of recognises it and says that they wanted to, in cooperation with public health, that they would prioritise and encourage cycling in those wards in terms of infrastructure promotion. But it's not necessarily the expertise of those people. So we've been trying to support the assets and the community people and people that are delivering on that to actually achieve something there. So again, you'll all be kind of familiar with these, no doubt. These stats that 1 in 3 Oxford households don't have access to a car. That rises to 2 in 3 if you're in Carfax, in some of those deprived areas of Carfax, and half the residents in the Lees and Wood Farm, or certain parts of that anyway. And of course, during lockdown, the ability to work from home also skews negatively towards those same groups of individuals that are facing those social and health inequalities. So that led Active Oxfordshire to partner with the Oxford Hub and some of the projects that Josh has already mentioned, but also it led to further research and conversations during lockdown, and that helps us realise that while safe infrastructure, as has been mentioned already, is key, and the lack of it is a major barrier to cycling, no disputing that. But without access to a bike, knowing how to ride a bike, having somewhere to keep that bike, it doesn't make much of a difference. So therefore, if we only develop the infrastructure alone, that has the potential to further ingrain those inequalities, particularly when one considers those communities' reliance on public transformation and the impact of COVID-19. Now, I want to play a quick video for you, just 2 minutes, of a lady called Sophia Hussain, who was the recipient of bike, cycle training, wayfinding support through one of those programs that Josh has mentioned. So I'm just going to let her put it in her words.
As a youngster, I used to cycle a lot, but my current situation, I'm not cycling as much because I have 3 young children to cart around Oxford, and so it's quite tricky to be able to kind of watch them and cycle myself, and often time is very much limited. We did receive 2 bikes for my youngsters actually from the scheme that you mentioned at the beginning, and they've absolutely loved the bike, so it's kind of encouraging us to cycle again. I think the barriers for myself personally is that it's quite expensive to kind of purchase a bike, and then there's quite a bit of bike theft in Oxford, so that's put me off a little bit. I'm a bit afraid to kind of save up the money, get a bike, and then have it stolen.
When Sophia said it's quite expensive to cycle and keep or maintain a cycle, I kind of disagree with that, because I think cycling and having a bicycle is cheaper than having a car. And I mean, it is cheaper than using public transport because it's free.
I think it was the initial cost that I was talking about, getting the money together to, say, for example, 4 cycles. So it would be myself and my 3 children, and then helmets, and then any maintenance or repairs. So it was kind of the initial cost that I would really have to save up for, whereas my car was kind of given to me. And it's an ongoing thing, and it gets me to places. I find it's very expensive then to kind of buy helmets, and it's a very kind of expensive thing to keep up, I feel, which is unfortunate, because we do try to be green and, you know, stay off kind of going in the car, but these are the barriers that are kind of holding us back. I remember once taking my little daughter's bike. Actually, it was a hand-me-down, and we went to get a new a new tire, and it was more than the cost of the bike.
Wow.
So, and then we just ended up scrapping the bike, and then, you know, not cycling, which is a shame, because my children love to be out there. Yeah, so I'm not skilled in kind of fixing bikes.
So Sophia there puts the case quite clearly. While many might well and rightly argue that cycling is cheaper than owning a car, such a binary decision without effective public transport is a luxury for some. And the initial costs of bikes and the knowledge gap for simple maintenance, i.e. punctures, etc., is a significant barrier. So while safe infrastructure is very much still that #1 barrier in a lot of this research, the simple provision of it without this whole systems approach, to refer to what I mentioned earlier, will be limited in its impact, particularly in those facing multiple social health inequalities and barriers. So this, along with some desk research, produced a dozen barriers of cycling. There's 9 listed out here, although some of these titles may be representative of more than one barrier. For instance, safety, that could be broken down further. Often it can be considered or focused on with the road infrastructure, but there's still multiple barriers that could be classified as safety, such as personal safety, that could be addressed through more of an activation approach. For instance, unsafe driving is one specific barrier that's been addressed elsewhere through taxi and bus driver education. Safety could also refer to somewhere safe for someone to learn or for a family to ride together. And this might also be addressed by off-road infrastructure. Or indeed, it might relate to the fear of crime. If we consider low traffic neighbourhoods, an intervention that's been shown to have significant impact on active travel levels, but low traffic neighbourhoods and modal filters are arguably nothing new to Oxford. Either that be through original design somewhere like Rose Hill or Nifley, or retrofitting also in Rose Hill and Nifley, to be fair. But large parts of the Great Elise Estate do prevent through traffic and are permeable through places like the Gilliam Park, though, with all those, you see all those green dots, those are essentially modal filters. But many of the local residents of this kind of talk in slightly feared terms about Gilliam Park as a place of drug users or not safe because it's flooded and things like this. And the local cycle lanes around there are overgrown, cracked, covered in difficult gates. So those assets that are already there, that infrastructure that's already there, is underused. So without public safety or the perception of it, that good travel infrastructure is limited in its effectiveness. So the local cycling and local cycling walking activation plan, the LCWAP, addresses these barriers and then looks at the assets to that local area, that place-based approach, which are either addressing those barriers now in current interventions, such as the things we've heard from earlier, Ready, Set, Go, Bikes for Keyworkers, Wheels for All, WOW, or assets that could support future concepts. So such as street tag, you may have seen some tweets about that, but it has a potential, a tag broadcast feature, which could allow people to actually highlight areas that they feel unsafe in walking or cycling, or pieces of infrastructure that actually they think should be addressed, and allow to broadcast that and ask other people, do you feel the same way? So that element of behaviour and cognitive change. Other things, I say, the community wayfinding, projects to educate professional drivers in safe passing, all things like this that could be part of those future projects. And actually, there's ones in course of development as part of the Emergency Active Travel Fund, such as training local mechanics, a means to keep the sustainable approach to the free bike scheme, and the cycle budgeting, which are now in development, and hopefully we might hear of funding for those successfully soon. So if you'd ask me what is the local cycle and walking activation plan, how might you get involved? Part of the answer is that many of you already are, because it starts from using the interventions that are happening in Oxford. And as Josh said, actually making sure that those things are actually being coordinated and collaborated, and that one passes on to the other. So not only in terms of obviously things like the bikes for Keyworkers and things like Josh was talking about, but equally, you know, the LCWAP actually has ISIS cyclists and your group rides listed in that. Now we need to engage with you and make sure that you become engaged in this, but you are an asset, and I'm sure there's other people that represent other organisations here as well that are assets. And indeed, so Oxford, what's managing the LCWAP is the Active Travel in the City group, and Cyclops is represented on that group already. And I've been helping to basically reform and reshape that to take responsibility for the LCWAP, because while it sets out the current status, it's also very much about those future concepts. And that can come from best practice from across the world, but then looking at what assets we have inside and outside of this virtual room to actually make those happen, and then try to attract funding into that whole plan. Therefore, the group must, of course, include cycling and walking organisations like yourself, but it also needs to have representatives of the communities we wish to engage in active travel, and other key parts of the system required to address those barriers, be that the police, or be that housing associations and employers. But it shouldn't be a talking shop, but a place where ideas can be introduced, and those who wish to pursue them can be supported to do so in a form of task and finish group, I guess. And you may well be members of or representatives of those community groups, or those employers, or those other parts of the system. And hopefully you might be able to encourage those to engage, and I guess we hope you will. So yeah, I guess, yeah, that's the LCWAP.
Thank you, Matt. I found that a really insightful view. I'd always had a rather simplistic approach, sort of, you know, build a path and they'll cycle along. But your explanation about the other barriers that could well make the infrastructure useless is really important. And so I do hope that this more holistic approach achieves success. And I think the map you showed at the beginning, you know, the fact that we think we're a cycling city, actually we're half a cycling city. So yeah, I think that's a very important message. And interesting to hear Sophia and her description of the capital costs, sort of initial investment. And we've heard that as well from the health workers, that you know, they've already got fixed costs, and it is an extra thing they have to find. And then when it gets stolen, that really is the last straw. Well, now, any questions for Matt? Either hands up or chat, or unmute yourself. I'm just looking around. Now Brian Robertson has a comment that focusing on wealth as a barrier to cycling, much better to... Brian, do you want to ask the question, tell us about the pedal pre? Where are you? Brian, do you want to tell us about the Australian initiative?
Yes, thanks very much, Andy. As an inclusive model for cycling, the Australian Pedal Pre initiative is absolutely wonderful. There, the children not only do the cycling, but they also make their own cycles and engage in races. And so this can encompass all aspects of cycling, from the engineering to the athletics to the nutrition, and it's extremely popular. And this kind of thing could be going on in Oxford.
Thank you.
And as I say, Brian, we welcome those ideas to come to the Active Travel in the City Group and to therefore become part of the future concepts for the activation plan. Just to answer your question, I wouldn't say that we're not focusing on wealth as a barrier, but nevertheless, it's looking at all of these barriers. That there's a wide variety of barriers, and that different people in different places will face different barriers, and that often they will face a multitude of barriers. And so, addressing one of those at a time is not enough, I guess. And it sounds like, just from what you're saying with regards to the Australian prize free, I mean, that sounds like pedal free, sorry. It sounds like that project in itself is addressing a number of barriers, a number of issues, and in terms of education and all sorts of different things. And so, yeah, if that's something that is a good idea, a good concept, and that there's energy in this room, or who are the assets, who are the people within Oxford community that could support something like that to happen? Is it the education system? Is it whatever it might be? And then who do we need to pull together to make something like that happen? And that's the point. It's working from what's strong and rather than what's wrong, and therefore bringing in good ideas from elsewhere that can work locally and be adapted locally through the strength locally. So.
Thank you.
Andy, one of the things that kind of a theme a bit on this chat is about bike theft. And Matt, I wondered how you are involving the police and to really help tackle bike theft, because that is a major barrier, as we said.
It certainly is. And if I'm honest, right now, we're not. I mean, we've engaged with the police a little, but we haven't really. I think you probably have stronger links than we do, Alison. And in fact, we were talking only the other day about one of the things that you mentioned, I think, on one of the COSAT meetings, and that we needed to talk to you to get the right link through to that, to bring them along. And that's it's all about making those connections and hopefully growing this. Yeah, this is a starting point, and hopefully we'll come further. Obviously, there's the bike register and things like that, but some earlier mentioned, does Cyclops need to have a cycle theft wing? And yeah, that's a good question. And it doesn't necessarily have to be Cyclops on your own. Who are the other people within Oxford who could support that, who make something like that happen? I don't know if that's forcing the police's hand or just supporting them or whatever it might be. But,
I'm thinking it was I did have a chat with one of the police constables responsible for bike theft in Thames Valley Police, and I mean, I need to get back to him. I mean, he was very positive about partnership working, and maybe, as a result of this session, I should get back to him and really do something under the LCWAP as a piece of work on bike theft, in particular in East Oxford.
That sounds great. I mean, essentially, part of the reason for bringing it all together in the LCWAP as well is, if we were looking for funding and things like that, that we can show almost match funding from different parts as well. So hopefully it allows us to, I guess, play the system a little bit, but also it's a genuine making sure that things are linking up. And on that note, there is some new money kind of Sport England have announced today. We're waiting for the final details on it, but it's their return to play pot, which for certain areas such as Barton, Blackbird Leys, Wood Farm, Carfax, Rose Hill, Littlemore, basically organisations from those areas or activities that benefit people from those areas, there's going to be a small grants fund. And, you know, ideas like, you know, the Australian pedal prix, if it's something that can happen quickly, because it's a COVID response type thing, you know, but again, it's trying to link that up with the right organisations within that community, so that it comes from outside, from within that community, rather than it being parachuted in as well. That's a really important aspect.
Josh mentions about Dr. Bike.
Yes.
Sorry, yeah, it's a bit of a random segue there. Sorry.
It's very relevant, actually. And
yeah, one of the offshoots of the Bikes for Key Workers project was that recently James and Catherine and the guys bid for some money from Cycling UK to run 3 Dr. Bike sessions for people in the local communities. And I think we heard last Friday that bid was actually successful. So basically we're waiting to draw down that money and put some events in the calendar and get going on that. But I just didn't want that to kind of, I forgot to mention it earlier. I hadn't realised it was sort of public knowledge yet. And it addresses again the maintenance issue for people. So if they've got a minor repair, people can bring their bikes along to a venue on a given time and date, and they'll be able to get it maintained. But I just wanted to sort of drop that in as a bit of an AOB, as I forgot to mention it earlier on.
Thank you. I think that'll be really exciting, and that's going to be in Rose Hill.
I think that was the plan. Yeah, I think that's right. I think Catherine's nodding, so I'd take that as affirmative.
Catherine, can we just ask you what the date is? It's in a couple of weeks' time.
Well, the first one's supposed to be the 7th of November.
Right.
The second one's the 5th of December, I think, and that's in connection with,
yes,
working with Rose Hill. And then there's another one in January.
It's a Repair Cafe.
Repair Cafe, that's right. The Repair Cafe,
December.
We're joining the Repair Cafe in December, and then it's January.
Thank you. Well, I think that's probably the right point to thank all our speakers, and I'll hand over to Alison just to make some closing remarks.
So thank you. Yes, and thank every speaker. I think it's been an absolutely wonderful and inspiring session to see what partnership working can do and the impacts that all our projects have had across Oxford, and particularly with Neha's and Faissa's experience of cycling as a result of the projects. I just wanted to reflect back a year from now, because last September we ran a conference called Like Riding a Bike, and I'm feeling so ashamed now that we didn't know about Active Oxfordshire. And and if we'd invited you, I think the conference would have been doubly better. It was a really exciting conference, and I will send Josh and Matt the conference report, actually, and we need to rewrite it now that we've got our partnership with Active Oxfordshire, because I think there were lots of ideas from that session that came out about how to get people back riding. But I think our experiences now as a result of COVID and our work on the Bikes for Key Workers with Active Oxfordshire has kind of increased incredibly, and the advent of the LCWAP, I think, is going to really help us make a huge difference across the city. So I want to thank everybody, and I hope you're all leaving very much inspired, and lots more work to be done starting now. So thank you all, and thank you, Andy, for hosting and chairing this session. You're muted, Andy.
Right, we'll end the meeting. Thank you very much for coming along, and we'll stop the recording. If people want to get back about getting to see it another time, we'll send round the link. Thank you all. Bye.
Bye.